right, let's get that response from the Health Department to what the Gift of Givers has been saying, that there seems to be a serious underreporting of cases in the Free State. Director General at the Health Department, Dr. Sandile Buthelezi. Doctor, thank you for being with us. DG, did you get a chance to hear what the Gift of the Givers is saying? What is your response to the claim that the real figures are just not being reported in the Free State?
Yes, no, thank you very much, and good evening to you, and good evening to the viewers. No, yes, we did hear what the Gift of the Givers is saying. I must say that when the minister did the press conference, he did allude to all the deaths. The only difference is that at the beginning of the cases in the Free State, the doctors were not doing tests because they were not suspecting the cholera, but we have been reporting on all diarrheal deaths and also on those that are confirmed. So the difference is that if we've not confirmed the case through the laboratory, which is the National Institute of Communicable Diseases, we cannot say that's a cholera case, but we can say it's a suspected cholera case. So we've reported all the deaths that we've received in the Free State, and the 8 in particular that have been raised, and the additional one that came in yesterday. So according to our records and information from the hospital, only 2 of now the 9 cases were confirmed through laboratory, but we have reported on all of them.
What do you mean? So you're saying that there are 9 suspected cases, but in only 2 cases has there been a positive result testing? I think it's stool testing or whatever you do. Only then do you have a positive result.
Yes. Now let me explain. You remember there were 8 deaths that were reported earlier in the Free State, of which 1 of them was confirmed. So we reported that as a cholera case, and the others, we take them as suspected cholera because they were not tested. And then there was the one that was reported yesterday, which makes it 9. So that means out of the 9 deaths that we have, only 2 were confirmed through laboratory as cholera cases.
All right, and how many of the 9 were tested?
They only tested 2 in terms of those cases, in terms of the information that we've received from the province. They were seen in 2 different hospitals, and the doctors were just treating them as diarrhea, suspecting nothing, and never took either the stool samples or the rectal swabs.
That's a huge oversight, isn't it, Director General?
Yeah, well, it depends. I mean, if you're on the field, you see doctors see diarrhea every day from different sources, maybe even sometimes suspected food poisoning, and they don't always test every diarrhea. But if you start seeing an increasing number of cases, I mean, in an ideal world, you should be testing every diarrhea, but we're not living in an ideal world. Unless if you then start having a high index of suspicion. That's what we've done now. We've instructed all our doctors to test all diarrhea cases and the laboratories to ensure that they get the results out as possible.
All right, so essentially you're saying that the Gift of the Givers is right. The death toll may be quite significantly higher, but these cases were not tested because they happened early on before there was a concerted effort to test around the cholera outbreak.
They are correct in terms of the number, but the minister, in his press briefing, he did mention the 8 deaths, that there were some other diarrheal deaths that were not commented. It's not like we've not reported on that. If you can go to your archives, when the minister did the press briefing, he mentioned the 8 deaths.
Director General, I just want to dig a little bit more, because the Gift of the Givers is saying that they spoke with people in Vredefort. As far as I understand, Imtiaz Suleiman is saying that it sounds like 10 people have died in that area alone. So that would just be one area. So could we potentially be looking at many more cases beyond the other 8 that you're talking about? Maybe there's a match-up there. But could there potentially be many cases that have been missed?
Yes, no, it may, because some of the people, they just die from home and they don't get reported. Families just bury them immediately, or they don't get to our information. But now when we've got our people going onto the communities and asking, they start picking up that there might have been some deaths. So I won't dispute the fact that there might be more than 8. but the ones that came to our attention through the Provincial Department of Health, that is the number that we received.
Director General, with all due respect, it sounds to me like you're admitting that government really does not have a handle on the overall figures right now. As South Africa, we don't really know what's going on. Is there going to be concerted testing? Is that what you're saying, that at least going forward we will know?
Yes. No. We have actually, I've met with all provincial heads of health. I've issued out a directive to all the heads of health to say, please, and we've also had a webinar with all the clinicians and written to all hospitals that if you see a diarrhea now, just treat it as cholera and then ensure that you do the swabs as well.
All right, thank you for your time. That was Dr. Sandile Buthelezi, Director General at the Department of Health.